Screen is visible. I'll make it full screen now.
Right.
Yes, sir.
Thank you. Thanks very much, Dr. Rakesh Gupta ji, Shri Arun ji, for giving such a warm welcome. You have always been very kind in your inspiration and appreciation. I very much appreciate that and feel very much obliged. To the participants, I welcome them. It's a very good afternoon. And I hope you're all very safe in this rainy season in every part of the country. I also wish to tell you that don't get sort of diverted because of the appreciation given. It's between the friends and expectations can be lowered a little. I am still a learner in tobacco control, I must tell you. And I keep working because that is how one gets knowledge, and knowledge is to be shared. So that is how I have always been working for the dissemination of the knowledge. And we all know that why this knowledge is so very important in case of regulating tobacco. And now we have come at a stage, as told by Arunji, that we have begun our campaign for the end game for tobacco in India. And it's not something which is unique to India. It is being done in many countries world over. And I think that's the logical progress that we have made in last 20, 25 years globally, that we all realize that tobacco is very harmful substance. In fact, it is toxic so much that it kills half of its lifetime users, and many more suffer from the tobacco-related illnesses. So leading a tobacco-free life is very, very important. And this case study, therefore, takes us to that point where, at least in our workplaces, how can we become tobacco-free? So there is a kind of evolution of how it worked out. Okay, I'm unable to move my slides. Yeah, all right. So it was sometime in 2007 that I was part of American Cancer Society as its consultant for India for its program called India Workplace Solutions. And at a program held in Jaipur for various workplaces, including the government workplaces, we had the opportunity, and we will consider ourselves fortunate that the director of Rajasthan Police Academy and some more senior officials from the police headquarters had come to listen to us as to what this workplace solutions is for the better health of the employees. And American Cancer Society at that time had been working in all the major metro cities, mainly with the corporate India for the employee wellness. And therefore, I got in touch with the members of Indian Association of Occupational Health, and its stalwarts like Dr. Shanbag, Dr. Rajgopal, Dr. Sham Pingle, etc. And I'm naming them because they are now the international personalities actually, and of people of eminence in the international arena of occupational health. So that is how I got also some inputs from them as to what is required for the workplaces. Rajasthan Police Academy was the maiden government workplace concurring to collaborate on its aim of having a healthier police workforce in the state. So this is what the initial objective was, for us to join hands together. And I had another role at that time besides as ACS consultant, as president of Rajasthan Cancer Foundation, because the police academy is based out of Jaipur itself. Now, for Rajasthan Cancer Foundation, the reason was little different. And we had just finished our initial initiative of smoke-free Junjunu. Junjunu became the first district city in India to be smoke-free through the implementation or enforcement of the Section 4 of the CODPA. And at that point of time, we found that there is a need in the country for addressing the problem of smokeless tobacco. So for us, association with Police Academy helped us to answer that uh, query that we had in mind. And more so, it was required in the government workplace in view of its higher utility for the state. Now, American Cancer Society at that point of time was already working on tobacco-free initiative with big organizations like Dell India, GE India, which are both placed in Bangalore. I also visited another corporate called Timken India, which had already set its norms as tobacco-free workplaces. So it was great to know that, yes, there are a lot of corporates which are trying to make their employees healthier by becoming tobacco-free. For Rajasthan Police Academy, it was a different situation. Why it wanted to be tobacco-free initially was primarily because of a maintenance issue, that the employees were spitting in the wash basins of the uh, police academy, in the office workplace, as well as in the hostels, which was bringing about the choking of the pipes in the sinks. And that was really a big problem for them because it had required a lot of maintenance and expenses thereof. So they wanted to be tobacco free for a different reason. So it was decided then that why should we become tobacco free? And it was through the introduction, it was understood and it was decided that becoming tobacco free at the institute will benefit the recruits as well as in the in-service staff. The academy also have the people coming from those who are in the service for long, and in all the cadres, right from their director general to the other people from the police headquarters and from other districts of the states. They all come for refreshing their knowledge. And so it will give them an experience of living in a tobacco-free environment. That was first objective that we decided. And second was that becoming tobacco-free will definitely be giving the people who will be experiencing this to work for better health of the police personnel wherever they will be posted. So they will be kind of ambassadors for becoming tobacco free in the workplaces. So these were two objectives which we decided to work with. Now the implementation or methodology required first was the concurrence with the director of the police academy and also the inspector general in charge at the state police headquarters on the policy for tobacco free RPA, which is very, very important in any organization, I suppose, where you require a concurrence with the administration, you require the leadership to know about it and take the call, because that decision is the most important decision, in my opinion, for any workplace initiative. As a second step, we held the meeting of all the in charges of all the sections which are there in the Rajasthan Police Academy. We held a meeting for almost over a day, gave them the knowledge about what is the burden of tobacco in India, what are the issues related with tobacco control, and why there is a need to be tobacco free, and what will be the impact of the outcome as if they become tobacco free, how it will help the society at large. So then we had also got the concurrence of the entire staff on the policy. Now, how was it done? I drafted a single pager on the policy as to why the police academy should become tobacco free, what will be done for this, or who will be monitoring this process, how the violations will be handled, and how we are going to be tobacco free approximately in what time that will be required. And we disseminated this to each and every person on the police academy premises. It almost took 2 weeks. And I wish to give you the information, and you should also consider wherever you are becoming tobacco free, that this concurrence is very important for the people to go ahead, that yes, we will go ahead with the process. And we gave the time to the section heads to explain it to them as to why becoming tobacco free is important and what will be done. Because sometimes there are hesitations, apprehension, protests, inhibitions, and people decline as to why they should become tobacco free, especially if there are people who are tobacco users, and that's a big problem in the police staff as such. Majority of them either smoke or chew tobacco. Then we conducted a general awareness program for the RPA staff on why becoming tobacco free and how. So a big meeting was held in the auditorium where the director was present, the deputy directors were present, the IG police came as well, and I made a presentation on the issues related to tobacco control. Now, following this, we had done the weekly monitoring for next 2 months of all the parameters through the staff interaction, which required to know about the active and passive smoking among the staff of Police Academy, and the presence of tobacco packaging and stubs in the litter, which was being collected every day, and it was analyzed separately. We also made an extended use of displays. The displays were put everywhere in the academy. This was one unusual feature of a workplace, because even the corporates hesitate to display the information in the form of posters, etc. But here, the people were very active to put the displays in there. In the
Please mute your speakers.
Yeah. So the use of displays was very useful here, and it was done on both the floors. Academy has 2 floors. It was done at the entrance of the stairs. It doesn't have the lift, fortunately. So we found that in the stairs, a lot of displays were put in, and on the first floor also. Now, the people are also empowered to watch for violations and their handling of how the violations will be handled. And a very useful method was proposed by the director RPA here. He said, we will not be charging people any money for the violation, but because we already have the inbuilt system of calling the explanation from the staff if they do not follow the instructions of the administration. And that comes under the general service rules. So they said, we will follow the process of general service rules for any violations which will occur, and then we'll ask them or send them an explanatory note as to why they have been using tobacco despite having agreed to the policy for tobacco free and for the administrative concurrence which has already taken place. So I think that is one point to be taken in consideration, that I think it's much better if you have the general service rules not to charge your colleagues the money, which brings more heartburn actually. And so 2, 3, 4 things which are here are very important to take note of the people who are actively using tobacco and for passive smoking in the verandas, etc., or in the rooms. Then seeing the tobacco packaging and stubs in the litter, which is collected every day. Trying to get the displays everywhere. High visibility is very important of the process. And then handling the violations through the general service rules. Then it is also necessary, and it was considered ethical as well, that we offer the treatment to the current users of tobacco. And that was the time when tobacco cessation had not really been established in the country. So we used American Cancer Society workplace solution called Fresh Start, which was a 4-week program. So every week we took up the one particular chapter of the guidelines or the booklet which was there on the Fresh Start, to let them know about the adverse effects of tobacco, how the quitting benefits, what are the ways in which you can handle the cravings for tobacco, what are the solutions and the skills to remain tobacco free. So this is being talked about. It's a kind of adult learning education module which we adopted here. And we found it very useful because except for one employee, all the people had quit tobacco by the time the course had ended in next 4 weeks. The police academy was then declared tobacco free by the IG, Inspector General from the police headquarters, a very reputed person, I would say. I can still recall his name, Mr. Devarajan. And he was known for his honesty and becoming very strict on certain issues. So he really gave a good leadership to the director RPA, another person whom I admire so much for his hardworking capabilities, the honesty and integrity, Dr. Bhupender Singh. So both of them were really very, very helpful for seeing that the process is implemented in the entirety to bring it to the formal declaration, which was done on World No Tobacco Day, year 2008. So uh, the process entirely took almost over 3.5 years, 3.5 months for us to get to the point where we can say that there was no tobacco use observed in the police academy on 31st May. Now, the sustained monitoring for this was done on the monthly basis for first 3 years. And thereafter, it has now become the part of the routine checkups, which is being done as required and as it is done for other needs of the police academy. So it's now how the staff engagement occurred in the implementation was that in-house engagement, the Rajasthan Police Academy director led the program upfront. That I have told you is very important. The administrator of the RPA, the Supreme Police, who was called Additional Administrative In Charge, was made the project in charge. Deputy Supreme Police was made the nodal officer for the entire coordination. So it's a kind of system that you require in place because to control a workplace, you need to have a cadre-based distribution from the leadership to the people who will be really doing the implementation part. And then the additional directors was engaged. He was a smoker and he initially rejected the idea of becoming tobacco free, and he was very vocal about it as to why should I quit smoking. And so when he invited me for the first time to his room was filled with smoke. And I said, I'm sorry, I will not come and sit with you in the room. Normally, you don't tell that to an Inspector General of Police in his own workplace that I will not come in your room to sit, because obviously what is expected is that he is the person to give you the permission to enter in the room. So he felt a bit offended, but he did come out of the room and I talked to him at length as to what is the need to be tobacco free. He said, I will talk about it, think about it. And he was a recognized author of the traditions in Rajasthan, especially in the tribal Rajasthan. So maybe it is the kind of his inherent property of thinking as an author also, which helped him eventually to decide on quitting tobacco. Now, all the section heads who were made responsible for getting the concurrence of the staff under him on tobacco-free policy and to resolve any project-related issues in coordination with additional administrator and the nodal officer. This also was very much an important step, that you need to have all the section heads talking the same language and telling their employees, monitoring them for the tobacco use and helping them to quit if they are the current users. So I think the next cadre, which is very important after the senior officials or the leadership in the police academy, are these section heads, which will eventually be getting the process implemented. So, and then we had all the employees in every cadre who were sensitized. One collectively as the Rajasthan Police Academy meeting, and then also through their sections, their families were also called at the police academy in the batches, and then the families have been living in the residential area which is adjacent to the academy within the same premises. Then the police academy also have some 1,200 recruits who live in 6 hostels. And they were engaged to keep their residential area tobacco free, especially their canteen. The contractor who was keeping the tobacco products within the canteen for supply had to be specifically instructed not to keep any tobacco products, and also to oversee that nobody is using tobacco while they come to the canteen for the relaxation. Now, the process was extending a bit to the outside of the police academy. The police headquarters was engaged to the Inspector General for administration and trainings. And the process was also extending to all 6 police training centers we have in Rajasthan. And these are in different parts of Rajasthan. So the process was extended in the form of information initially to them that the police academy is becoming tobacco free. And if anybody is visiting the police academy, they should take care that they will not be using tobacco within the premises. So the same was done for the state police headquarters. In fact, one of the instances was that the Director General Police then, who was a chronic smoker, he visited the academy during the program. And when he came in, he smoked his first cigarette. Nobody, out of courtesy to the senior most police person in the state, told him to stop smoking. And so he smoked the first cigarette. And after some time, he felt again the need to smoke again. And then he realized, because he had seen the displays of Tobacco Free Police Academy. So he said, no, I must go out of the premises to smoke. So he took his car, went out of the premises, he smoked his cigarette, and then came back again for the meeting. So the environment does have the impact if it is followed in the earnest. So the outcomes were that, as I told you, the police academy was declared tobacco free on World No Tobacco Day 2008. This, in fact, was the model of a government workplace becoming tobacco free. I don't think there are many government workplaces which are tobacco free, although we have some kind of policy for the health facilities to be tobacco free. And I'm told by the state tobacco control cell that nearly 70% of these health facilities are tobacco free. But I consider that maybe an overestimate, or this has not been reviewed with a kind of strictness and the needs which are required to declare a workplace tobacco free. Hospitals in particular are very difficult places because many people visit the hospital on any day for the first time. They don't know what is the concept of tobacco free. The displays are missing, so I don't expect that so many health facilities are actually tobacco free, as has been the status of the police academy. So I did not go to police academy actually after 2011 or 12, and then maybe once in between. But last year I made a specific visit when the workshop was held at Chandigarh by the RCTC and Sipher to know about the best practices. And I said, let me update myself also. So I did an on-site evaluation last year. Sorry. And it confirmed the status of the police academy staying tobacco free. Sorry, I have severe flu and kind of influenza, which is.
You can have water if you want.
Yeah.
Or lozenges if you want.
Thank you. So as a spiraling effect, then all the 6 police training centers became tobacco free by January 2010. So it took almost 1.5 years to make all these police training centers becoming tobacco free. We held 3 day-long empowerment sessions for the various cadres of their respective staff. Initially, the commandments had come, and then we had called the administrators, then we had the medical teams of doctors and nurses to visit the police academy to tell them as to how the current user should be treated. And I also visited 2 of these police training centers nearby Jaipur, and I found that they had actually become tobacco free by the process that we had adopted at the police academy. Now, one of the challenges I already told you that the deputy director and the principal of police academy, who was initially smoker, in fact, there were two people, so they had quit during the process itself. The residential block, which is within the police academy premises, it could not be formally declared tobacco free. Obviously, we could not have a reach to them, and we expect that if there are 250 staff in the police academy, we can expect 5 times more people living in these premises. There was an absolute lack of media engagement after the formal declaration of the police academy as tobacco free, which could have encouraged actually more government places to consider becoming tobacco free similarly. And that was my vision and hope that if the workplaces become tobacco free, eventually the city will have the zones which have become tobacco free. And that will sort of provide a culture of a community or a city becoming tobacco free. So that is yet to happen. And I also had my full-time engagement with the American Cancer Society until December 2010. So which in a way stopped my frequent visits to the police academy. And also the people who were leading the police academy, they too got transferred in the interim. So these were the challenges which you expect to be there in every workplace. And therefore sustainability is very important. And but we found that yes, it had an indirect effect on the major police establishments in the city. The police headquarters is absolutely tobacco free even now. The police commissionerate is also very tobacco free. In fact, it took the drive to control the advertisements, implement the section 5 in the earnest, especially at the retailer shops. It also had the anti-corruption movement. It had called the people from tobacco industry to tell them to remove all the advertisement boards. So it was done as a drive 2 times. Our central office of the prisons, this is also tobacco free. All these are tobacco free actually environmentally, but none of them really worked or implemented the process to become tobacco free formally. So this is what I can confirm by my visit to all these places last year without any prior notice. Also, I found that the model of tobacco free Rajasthan Police Academy is a self-sustaining model. Now it is almost 16 years that it became tobacco free. I can give the credit to this to the ownership that the people in-house have in the academy, and also the seniors who have been leading the police, state police. It has been integrated now in the regular monthly monitoring of the police academy to see that the workplace is tobacco free. They added actually one more item to be the plastic free also. So they are tobacco free, they are plastic free. And the violations are extremely low in number. And these generally get resolved with the counseling alone. They do not even require the explanatory notes or the disciplinary notes from the administration. So I consider this is good model, but yes, I would also say with my perception that police force is relatively a disciplined force as compared to the other workplaces where discipline counts. It is accounted for also, and people are punished if they become indisciplined, which may not happen in the other government workplaces. It may not happen to that extent in the corporates. Corporates do have a kind of discipline, but as was told by Dr. Amar before we started this session, that there are smoking areas within the workplaces which are clear violation of the section 4 of COTPA, that no, there should be no smoking areas anywhere in the country except at the airports and the hotels and the restaurants with people of with the capacity of more than 30 people sitting or dining there, residing or dining there. So I think it's very important to understand as to how we can make the police academies tobacco free wherever we are. There, if you can motivate the leadership or the leadership can think about the employee wellness as an issue, then making the police headquarter or making the police academies or thanas becoming tobacco free is important. We tried to work for police thanas in Jaipur to become tobacco free. We could not do that because we found that it was difficult. The commissioner police who was initially helping us, he tried his best. He did the monthly review meetings also for almost a year, but we could not set up the formal process of becoming tobacco free. They thought that they could do it without adopting it, but it did not work that way. So I think having the process as such, have right from the draft of the policy to the work plan for having a implementation process in place and then monitoring it and evaluating as to what all we are achieving. I think those are very important aspects to understand to this challenge and the failure that we had not to make the our inability to make thanas tobacco free. But there had been a bigger translatory value for the model was presented to the Commonwealth Secretariat by a C3, a UK-based organization. The lady had visited Jaipur and she met me. And then she presented it as part of 17 good case studies to control NCDs in the Commonwealth countries with a population of 2.2 billion. So I consider that was a great recognition. We were very happy that we have got the international recognition. But yes, as I told you, that thanas did not become tobacco free. Beyond the sensitization of their station head officers, SHOs, I think it is very important that what happens locally, I think, is more important than what happens internationally as a policy decision. The second takeaway I can say is that, maybe this is that the Tobacco Free Police Academy, after 3.5 months of working, upscaled the model of smoke-free Junjunu. It could address the issue of smokeless tobacco. It provided a model for workplaces to become tobacco free. It was actually taken up at the national NGOs meet, and some of the institutes tried to work on it. I consider the workplace initiatives of the preventive oncology department of Tata Memorial Hospital. They are the people who have done a lot of work with the workplaces in Mumbai to be tobacco free, and they have made certain publications also. So the police academy experience and becoming tobacco free appears replicable if there is a leadership engagement upfront, adoption of workplace specific policy, and its ownership by all the stakeholders. All these three components are very important. And then commitment to maintain the status for at least 3 to 5 years. By then it becomes a norm of behavior. Therefore, this is very important that you may have the process in place to the concurrence of the leadership. You may implement the process in earnest and to the specifications which are required. You may have the place formally declared tobacco free, but without maintaining this status for next 3 to 5 years, you cannot really achieve the kind of status the police academy has today, that it is tobacco free after 16 years. So I think I'll stop here at this point and I'll welcome your questions. These are some of the references which we have used in this presentation, and you might read about this. I'll share the PDF of my presentation to Sipher for dissemination. And I'll just end it here. If there are any questions, I'll welcome that. I'm sorry again for the voice breaking because of the sore throat that I have. So,
But still, Doctor, we are thankful that you could make it. So that is important. Thanks a lot, Dr. Gupta. And you made a real good presentation. I think most of the people who participated, they will be encouraged to make their own workplaces tobacco free with this. It is a very encouraging study, in fact, and you shared your own experience. So leading tobacco free life is really important. Workplace need to be tobacco free. That is also important. As part of the American Cancer Society in 2007, you took up this RPA Center as tobacco free, and it was declared in 2008 on World No Tobacco Day. And before that, I think Junjunu was declared as first tobacco free city. So that is also important because people they think that Chandigarh was the first tobacco free city, but I think Junjunu was the first city.
Yeah, as chronology, we declared Junjunu smoke free in May 2007.
Yeah.
Chandigarh became smoke free in July 2007 or 2008.
Yeah. And actually, Chandigarh became tobacco smoke free uh, uh, without any basis. I mean, no study was conducted. It was self-declaration. But was also good at that time because nobody had that protocols for the study. So that time, I think that it was good that a self-declaration was made.
It
And
was
it is,
actually, that was an interesting story.
yeah.
One that the Hemant Goswami who did it knew
Yeah.
it from me what I was doing in Junjunu. That was sometime in February. And
Okay.
he was an advocate by profession. I don't know
know.
if he's still sort of practicing advocate. But then he found out the ways in the legal system as to how it can be done. And he went to the police department and the IG police, who was in charge of the Chandigarh territory.
Okay.
And then he also filed a PIL in the court.
Okay.
And that is how the declaration could be made through the dictat.
But that was really good, actually.
Yeah,
And
so
Hemant, he's a very passionate person. I
yes,
don't think he's anymore, practicing as a lawyer, but he's more of a RT activist. And because of him, actually, that Burning Bridge Society case, that
yes.
we could do much about hookah bars and getting into that list of the poisons in Chandigarh, Punjab, and Haryana, all three places.
Yes.
And we also acted upon e-cigarettes under Drug and Cosmetic Act because of his PIL. So I think that is important. And one thing interesting is that why the Rajasthan Police Academy, they wanted it to be tobacco free because of the spitting habit.
Yes.
And the pipes they used to get clogged. So it is good that you were able to tackle that problem also, the smokeless tobacco problem. And I think it is more of a problem in India because Dr. Jeda Muhammad, he shared some insights into his own country, Bahrain. In Bahrain, actually, it is banned inside the workplaces. I am really hopeful that it is implemented also very strictly. I'll share some of the chats. He was,
Yeah,
you have seen that. Okay.
Yeah, I can see those as well.
Okay.
And, my answer to this is that I don't know if Bahrain has any kind of the act as we have in the country for what we call the Cigarette and Other Tobacco Products Act, CORT-CUPA, that I have referred to.
Yeah.
Because having an act like this at the national level is very important.
Very important. Yeah.
Bahrain is relatively small country, but it's a kind of monarchy.
Mm-hmm.
The system is very different. But if the monarchy decides, I think a lot of things can happen. And to my knowledge, I think they are smoke free in the country. But yes, some violations require to be dealt with. And I'm very hopeful that the violations are being handled appropriately as per the norm setting. There was also a question from Dr. Amar as to, and Mr. Feda has also asked that whether we had any data beforehand. At that time, we did not have the data of the Global Adult Tobacco Survey, which came 2011 or so. So, but it was more of a perception of working in the hospitals and in the communities that how prevalent the smoking and smokeless tobacco are. And we also knew the need for becoming tobacco free instead of just becoming smoke free. And that helped us to take this initiative.
I think at that time, gas was also not out.
No, it was not there.
There were no funding.
But we had the data from the National Family and Health Survey, NFHS.
Yeah.
This has been there for pretty long now. And we had some information as to how many are the smokers. And NFHS primarily reports on the smoking, not even on the use of smokeless tobacco. And it gives a different division between men and women smokers. So we had known the prevalence of tobacco use
But not exactly, actually.
Not exactly, not beyond that, as the GATS provide us the information.
So Dr. Ramprasad, he has also joined.
Yes,
but
yes,
before,
he is very welcome.
But before
Sir, thank
Dr.
you so much.
Ramprasad, yeah, thank you.
Sir, there's one query which I had in mind. I just wanted to clarify.
Okay, sure.
Yes.
So this aspect of numbers in private places, now private organizations with 30 or more working people, if they by themselves have declared an area as a smoking area and non-smoking area, can that be challenged, sir, as addressed? Can that actually be challenged according to COTPA? Or because they say that we have created a separate zone, no, this is happening because many places we have seen that they have created a separate smoking zone. So can that actually be challenged, and any experience in relation to that, sir? Thank you so much.
The clear violation of COTPA Section 4.
Right.
It's a clear violation. So it can be challenged legally.
Okay.
Only thing is that because who will challenge the bosses in an organization? That's the problem.
Right.
If there are NGOs in the area, I think they can definitely approach these people.
Okay.
Tell them that we will revisit again. If we found smoking, we will report it to the district tobacco control committees, which are now operational under MPCP, and the people can be charged. They can be charged for the violation.
All right. Yeah. So because especially I've seen that happening in IT parks, sir. IT park
that is not correct.
Organizations and software
actually,
companies.
as told by Dr. Rakesh Gupta, it is not as per law. As per law, we can have only smoking areas in airports, in restaurants and hotels with 30 with capacity of 30. Yeah. So nowhere else there can be any designated smoking area. And designated smoking area, they have got very strict norms also. You can't serve liquor or water or food within the smoking area, because some of the hookah bars, they are working, they are functional in that way, that as if they have declared it as designated smoking area, but that is not correct. Right. So I'll request Dr. Jayadam.
Rakesh, let me add one more thing for designated smoking areas.
Yeah.
That this was actually the tobacco industry intervention, or to dilute interference, actually, to dilute COTPA at that time.
Right.
At that time also that there should not be any designated smoking areas.
Right.
Okay. All right.
Understand that it was tobacco industry interference. And we have, in 2010, when we were asked to propose the amendments to COTPA, this was one of the amendments that we had suggested, that we should eliminate designated smoking areas as the provision anywhere in the country.
Yeah. And we are soon going to have a meeting organized by the National Law University of Odisha in Delhi very soon. Yeah. So thank you, Dr. Ramprasad. And Dr. Jeda, will you like to add something about the vapes you said, or the electronic cigarette use you told? Is it allowed in Bahrain? Yeah, is it allowed in Bahrain? I think we have lost contact with him. So, Verma Saab, will you like to give some concluding remarks on the presentation and any closing comments?
I think I am nobody to give any remarks.
Dr. Feda is here. Dr. Feda, do you want to talk about vapes?
He has given his comment already. That
Hi dear, good evening. Actually, in Bahrain, vapes is not allowed for teenagers less than 18. It is not allowed. But certain condition, there is a broken in the rules and regulation. For that, we have a hotline through public health direction. They will send any outbreak rules.
Okay.
Dr. Feda, I think you must adopt that comprehensive ban on electronic cigarettes as done in India and 33 more countries. You just go through PICA 2019 of India. So maybe we can help you out if you If you want us to, participate in a Zoom meeting with higher officials, we can do that. Dr. Rakesh
Okay,
Gupta
dear.
and me, yeah, we can do that.
Okay, dear. Thank you.
So over to Mr. Arun Verma.
Thank you, Dr. Rakesh. No comments to offer, but I must appreciate the model which Dr. Rakesh Gupta has launched, which was his brainchild or initiative or thought process, whatever we may call it. That even 16 years after the making this academy, police academy, smoke free, it's still today after 16 years, the results of the inspections are so good, because normally it's very easy to declare something smoke free. Chandigarh was declared smoke free, but I don't know, every road I see the people smoking, every road I find the vendors sitting selling the cigarettes, even to the minors, or minors are selling. But that's a very, but I think apart from what initiatives Dr. Rakesh Gupta said, that the involvement of hierarchy, I think that's the wonderful job done by Dr. Rakesh Gupta, because hierarchy down or up the line, who were part and parcel of this project and who has taken the ownership of this project, which resulted into extending it to the police training centers, though they could not make the residential areas smoke free, but the offices and the police training center, the headquarters, and especially the deputy director who was a committed smoker, to make him to quit smoking. That's very interesting part of it. And also the translator values which has gone to the about the control of the NCDs in the Commonwealth Secretariat. That's also very appreciable for the efforts put in by Dr. Rakesh Gupta. So thank you so much with these comments, and now over to Dr. Rakesh Gupta. Dr. Rakesh, you are mute. You are mute.
So we must formally thank Dr. Rakesh Gupta from the Rajasthan Cancer Foundation, Mr. Arun Verma, who is actually part of the Sipher team, and all the participants, Dr. Ram Prasad, Feda, especially because Feda, she has joined from Bahrain, and Dr. Ram Prasad is a very regular with us. So thanks a lot. Thank you. Namaskar.
Thank you very much, and thanks to you both specifically.
Thank you so much, sir.
Thank you so much, sir. Very insightful. Thank you so much.
Thank you.
Very interesting presentation. Very interesting.
Thank you. Bye.